Ken is on because he's going to get this off here, and I can be quiet. So let me pull up his file. Sorry. Okay. So welcome everybody to our Sunday Mornings with Twitchy Women. Today's guest is Kenneth Thurman, who will be speaking about the Aware and Care Kit from Parkinson's Foundation. And if you don't have one, he'll tell you how you can get your own very soon, free from the Parkinson's Foundation. I use mine all the time when I travel. They recommend it. The whole idea is to have this for the hospital visits. I use it when I travel because it's a place where I can keep Parkinson's meds in one place and all the information I need. So let me tell you a little bit about Ken Thurman. He spent 45 years as a faculty member at Temple University in College of Education and Human Development. He was diagnosed with Parkinson's in August of 2017. At the time of diagnosis, he made a commitment to live well with Parkinson's and to encourage others to do the same. He is currently an ambassador for the Parkinson's Foundation, which provides him the avenue to make people with Parkinson's and their care partners, as well as hospital staff, aware of the risk of hospitalization. He also co-founded the PALS Project at Jefferson with Dr. Salwai Lang, which provides peer mentoring to people with Parkinson's who are struggling with their diagnoses. And we also just did a little what we call Jewish geography and discovered that we grew up in the same city and that his grandfather was my rabbi. So we have lots of connections here. So with that, I want to welcome Ken and turn it over to you.
Well, thank you, Sharon. I'm happy to be here. And can I give Susan Lehman a shout out because she's the person who really made me aware of Twitchy Women to begin with and was actually helpful in getting the PALS project because I think you guys do something similar where you hook people up with mentors. So thank you, Susan, as well. Okay, may we have the first slide? Okay, so what we're going to talk about today is, as Sharon said, is Aware and Care. And it's a program that's developed and sponsored through the Parkinson's Foundation about, I think, I don't know the exact date, but I want to say about 8 to 10 years ago. And I'll tell you more about it as we go forward. Next slide, please. So why are we here today? Well, we're here today to help people affected by Parkinson's understand the risk associated with hospital stays, to get tools to play an active role in their care, be prepared for a hospital visit, whether planned or unplanned, and develop strategies to get the best possible care in the hospital, essentially to be aware of our care when we're hospitalized. Next slide, please. So we make some assumptions when we go into the hospital. We make an assumption that they will get in touch with our neurologist. We make an assumption that the pharmacy will have the PD meds that we need. We make an assumption that the staff, the nurses, the LPNs and so forth will know and understand the symptoms of PD. We make an assumption that our meds will be delivered to us on time. And we make an assumption that we will be given drugs that are safe rather than are unsafe, and that the staff will know that. So we make all of these assumptions. And as we'll see in a couple minutes, some of those assumptions don't hold so true. And so they really need to be addressed, and that's why we're here today. Next slide, please. So here's just some interesting data to show you why this is so important. Compared to control cohorts, PD patients have a higher rate of hospitalization. So we are hospitalized 44% more than our peers without Parkinson's. Next, please. And when we are hospitalized, we tend to be hospitalized longer. And depending on what study you look at, that length of stay can be as much as 14 days. So somewhere between 2 and 14 days longer is what's shown in the research literature when you're hospitalized with Parkinson's. And again, what we're talking about, it doesn't necessarily mean that your Parkinson's is acting up. It means that you're in the hospital for any reason. So if you sprain your ankle playing pickleball, you might end up in a hospital, but it's not related directly to your Parkinson's. Next, please. So the other thing that we find out is that avoidable complications are higher for people with Parkinson's than those peers without Parkinson's. So again, if we go in the hospital, we are more likely to experience a complication than we would be if we didn't have Parkinson's. Next, please. So we're less likely to be sent home after hospitalization. On average, 62.9% of people with Parkinson's are discharged to an assisted living, nursing care, or rehabilitation program or hospital. So the one thing that I think this figure is probably inflated a little bit in that some of the people that were sent home from the hospital to assisted living probably started out in assisted living or maybe even in nursing care. So it may be a bit inflated, but the fact still remains that we are more likely to be sent home to someplace other than our home, because as you see, only 33.2% are discharged to their home. And the 3.9% or 4% basically resulted in inpatient mortality. Again, which is a higher number than you would expect from people without Parkinson's. Next slide, please. So imagine 12 people with Parkinson's. Within the year, 4 of them will be hospitalized. Of those 4, and this is a scary stat, of those 4, 3 won't get the right medicine on time. And of those 3, 2 will have complications as a result. So what that basically means, if you boil it down, is that 2 of every 12 people with Parkinson's, or 1 in 6, will have avoidable complications because the hospital doesn't understand their needs. And everybody lives different places, but many of you probably are at a center getting treatment where they have a center of excellence. And this, even as we'll see in a second, holds true for centers of excellence. So next slide, please. Okay, so what you need to really be aware of is what we abbreviate as MODS, or medication changes. And what that stands for is missed. Medications are entirely missed by error because PD is not mentioned in the electronic record of the person. So one of the things that the foundation is actively doing is we're working with hospitals to try to get the EPIC system, which is the patient record system that most hospitals use, to explicitly include a piece that determines whether or not a person has Parkinson's at the point that they actually enter the hospital. Again, and it doesn't matter whether you're entering through the emergency room or you're entering for something that's planned, that's a planned visit. So the bottom line is that medications are often missed. Medications are sometimes omitted and withheld intentionally when a clinician incorrectly assumes that NPO, which means nothing by mouth, that should be also omitted, meaning the medications that you take for PD. And that people with severe swallowing dysfunction justifies omission of medication. And again, there are ways that medications can still be delivered for people that have swallowing dysfunctions. Okay, and this is also very common, that medications are not distributed precisely at the home schedule, but rather at a standard window. What that means is most hospitals have a 2-hour window where they assume that it's okay if you take medication at 7 in the morning to wait till 9 or 9:30 to give it to you. And as you know, for most of us, if you skip your medication, you see some really profound effects. So one of the things that's also being worked on is to get hospitals and hospital pharmacies up to speed on the fact that if you take medication for Parkinson's, it's got to be delivered within a fairly tight window, or it can have significant side effects. And then the fourth thing that happens is oftentimes the distribution of medication other than the exact medication. For example, some of you may be taking immediate release levodopa, but they get immediate release and you on continuous release. That can be, as you might suspect, problematic. The other thing that sometimes happens, and this is not always an issue for people, but sometimes you end up getting a generic rather than a brand name. And I think all of us know instances where people were given a generic rather than a brand name, and it had implications for how well the drug worked or what kinds of reactions they had to the drug. Okay, next slide, please. So here's something to remember. Anti-Parkinson's medications are as necessary to a Parkinson's patient as insulin is to a diabetic. Okay, and this sort of just summarizes what we're talking about. Often PD medication schedules are changed in the hospital. This change may result in a greater risk for disability and consequently an increased risk for accidents and other complications. The acute discontinuation of PD medications can be life-threatening. So again, if you go in a hospital and you are on a regular schedule of levodopa and you are just abruptly cut off from that for 12 or 15 hours, it can have serious side effects. And in some instances, as I said, lead to death. Okay, next slide, please. So why is this happening? Well, it's happening basically because of lack of awareness. Lack of awareness of the critical importance of Parkinson's medication timing, lack of awareness that poorly managed Parkinson's might result in mental confusion or other serious symptoms, lack of awareness that many common medications used for pain, nausea, depression, and psychosis are unsafe for people with Parkinson's. So let me just give you an example. If any of you are familiar with the fact that when people, especially people like myself who are older, go in the hospital, we sometimes get confused, we sometimes have hallucinations, we sometimes act out, we sometimes have a phenomenon called sundowning, where we sort of appear to be confused or even show the symptoms of dementia. What some of you may know that the most common drug that's given to people who experience those kinds of behaviors in the hospital is Haldol. And if truth be known, Haldol is very unsafe. It's probably the worst single drug that can be given to people with Parkinson's, because what it does is it reduces significantly the amount of dopamine in the system. And as everybody knows, dopamine deficiency is what accounts for our Parkinson's symptoms to begin with. So that's just one particular example of a drug that should never be given to people with Parkinson's. And so it's pretty telling. I mentioned this a little while ago, but even the best hospitals, and even when treated at hospitals that have centers of excellence, we need to intervene, and this will continue to happen unless there's hospital intervention. And one of the things that the Parkinson's Foundation has going on right now is what they call the hospital initiative, where they are beginning to work with hospitals to get them to change their procedures and proceed and be more in touch with the needs of people with Parkinson's, both through medical records, but also in the way that medication is delivered and medication is taught. So if any of you are interested in that, we can talk a little bit more about it. Next slide, please. Okay, so here are some things to remember. Any of us that have Parkinson's know that Parkinson's in each person is unique. And so that's just all that this is pointing out. Each person with Parkinson's has a unique combination of medications and listed regimen. Each person with Parkinson's has the best knowledge of their disease or other conditions, but may have communication challenges. Care partners can have all of the above information and advocate for the person with Parkinson's. And the aware and care material should be used from admission to discharge to ensure the best practices are followed. So one of the things that, one of the stories that I like to tell is, because it's apropos to this particular slide. So when I was first diagnosed with Parkinson's, I was seeing a physical therapist who at the time, he was actually doing therapy on my back, but he was also certified in LSVT big. And he put me in touch with one of his other patients. And that patient said to me that when you have Parkinson's, you have to learn to adjust your sails, meaning like the sails on a sailboat. So, but we each adjust our sails differently, and we each adjust our sails even differently on a given day for ourselves. So what we have to remember, and this is particularly important when you're hospitalized, is that each of us has a unique set of characteristics related to our Parkinson's, as well as a unique set of medications. And it's important for us to let that know, let the people who are taking care of us in the hospital. Okay. Next slide, please. So the Parkinson's Foundation's Aware and Care campaign can help everyone be better informed. And so what we do is we talk to people that have Parkinson's through organizations like Twitching Women or various support groups in our own individual areas. We inform care partners and families as to what are important pieces of information to know. We do the same thing with healthcare providers and hospital and facility staff. So the mechanism that we use to do that we sort of try to get into people's hands is the Aware and Care Kit. Because what the Aware and Care Kit does is it helps patients and families plan for a hospital visit and advocate for the best possible care during the stay. All right, next slide, please. So here's a couple of stories from the helpline, but before I talk about these, let me share a story with you that was actually called into the helpline at the Parkinson's Foundation a little over a year ago. It's a very, very sad story, and it's a very, very true story. Gentleman was admitted to the hospital who had Parkinson's, and one of the things, one of his symptoms or one of his issues was impaired swallowing. and his wife now was not able to get very good access to him in a hospital. And I don't, he went into the hospital, I think, for some unrelated thing to Parkinson's, but his wife tried to get access, and this was while COVID was pretty rampant still, so that interfered with her ability to get access. They wouldn't listen to the things that she was saying to them that were important for him to and for his care. Long story short, this gentleman had swallowing issues, and they were not feeding him correctly. And as a result, he actually got aspiration pneumonia and subsequently died from pneumonia. Perfect example of had the hospital been more responsive to his particular needs as a Parkinson's patient, he probably would be alive and with us today. So here's another couple of short stories. The doctor was about to give me Haldol. I said, I looked it up in my kit and it's not appropriate for people with PD. Here's another one. This was my first time at the hospital when a nurse was aware of the importance of meds being taken on time for Parkinson's patients. And this is a result of the person having the kit and sharing the information from the kit with the nurse. Next slide, please. Okay, so Sharon showed you a little while ago what an aware and care it looks like. I can't see everybody, but maybe Sharon can. What percentage of the audience actually has an aware and care kit? Can you raise your hands? Or Sharon, are you able to see everybody?
No, I have to change the view. Hold on. Where's my view? Oh, okay, hold on. I can change my view. Okay, let's see. I've got, no, I'm not, oh, here we go. I'm not getting the grid because of your
You use the little hand raiser on the reactions, or you can.
Yeah, but I'm not getting everybody. Let's see. There are quite a few. Let's see.
Well, maybe some of you have stories you can share.
Okay, you know what? Stop sharing the screen and then we can go to the grid view and then we can see.
Oh, okay.
That's how, I guess the only way we can do it. It's not letting me show everybody. Ashley, can you change it to a grid view? No, it's not working. Oh, here we go, gallery. There we go. All right, now everybody can raise their hands.
The gallery.
So the question was, who has the kit? Right? Okay. All right. You want to go back to the screen share?
So most of you have it?
It looks about 50-50.
Okay, that's what I would have figured.
Okay.
So for some of you, this is just a refresher, but here's what an aware and care kit looks like. There's several ways that you can get it, and they're outlined here. You can go to, first of all, you can go to parkinsons.org/aware and care. And that's how you can order the kit or the materials. So the first thing is just an online download for free. You can go and download whatever pieces of the kit you would like to have. Then there's the Aware and Care packet, which is also free, but can be ordered. So what that means is you can really order all of the materials that are in the kit, but you won't have the actual little black kit. And then there's the Aware and Care kit. which technically is also free, but there's an $8 shipping charge. wh- One of the things that I've confronted because of COVID primarily, is I've been doing these presentations mostly on Zoom or some other online, mechanism. And that prevents me from being able to actually hand out kits. I was at an event this past weekend where I was actually able to set up a table, and I ended up handing out 30 some odd kits to people who were attending the event. So if you don't have a kit, I urge you to go to parkinsons.org, aware and care, and order what you need. The other advantage to having the actual kit is that a lot of people, as Sharon was suggesting earlier, a lot of people actually put their medications in the kit, and if they get their medications from the hospital, fine. If they don't, they have them in the kit, and they can either take them themselves or depend on their family or care partner to give them to them. Okay, next slide, please. Okay, so you can't really see this too well, but this in the kit. Let me. Well, that's okay. I was going to hold it up to make it a little closer, but in the kit, what you have is something called a fact sheet for nurses. It's a tear-off pad, and it's probably the most important single thing in the kit, because what it does is it shares vital information about Parkinson's, and it gives you a way to do that with every member of your care team. So it addresses care considerations, medications to avoid, and safe alternatives, common PD symptoms, typical PD medications, and info about DBS and Duopa if that's relevant. So what we really recommend to do is you have this tear-off sheet in the kit. As soon as you get to the hospital, you or your care partner should start handing these out. So if you go into the emergency room and a nurse comes in, somebody should tear off a sheet from the fact sheets for nurses and hand it to the nurse. And don't be afraid to hand these to physicians, by the way, either, because oftentimes, especially in an emergency room situation, you may have a physician that doesn't really know that much about what should or should not be done with people with Parkinson's. Okay, next slide, please. Okay, so the other thing, and this is really relevant for anybody, but it's particularly relevant for those of us with Parkinson's. There's a medication form which you can fill out and which you can keep up to date if there's changes in your medication protocol. So the advice is to complete the form and keep copies in your kit for use at the hospital. Now, most hospitals who use Epic are going to have access to your medical records and your drugs, but I would still urge you to fill this out and keep it in the kit so that you can share it with people. It's a good way to look at checks and balances to make sure that everything is in your medical record. And this tells you, if you download the form, you can actually fill it out on a computer before you print it. So what does it highlight? It highlights your personal information. It lists your medications with doses, frequency, and timing. It checks off your special considerations for DBS, Duopa, so forth. So it gives the medical professional a synopsis of your issues in a very easy to use form. It's up to us to keep it up to date, however, so keep that in mind. Next slide, please. Okay, In the kit, you will also find a little booklet called Hospital Action Plan. And I would suggest that you read that little booklet and maybe go back and even read it periodically, because we all forget stuff. But it tells you how to prepare for your next visit to the hospital. Whether it's a planned visit or an emergency visit. It lists 6 steps of optimum care. It gives you a checklist. It gives you a checklist for both. Well, it gives you 2 checklists, actually, one for a planned hospital stay and one for an emergency hospital stay. And then it also gives you some information about special considerations. Okay, next slide, please. Okay, it also has an information card in there about deep brain stimulation. So if you've had DBS, it highlights precautions about DBS, what people need to know about DBS, a checklist for an emergency situation. For example, if you need an MRI, and it also has device-specific instructions and for diagnostic and therapeutic procedures. Next slide, please. Same is true of Duopa. If any of you have a Duopa pump, it gives the care provider information as to the components and what they need to know and precautions and so forth. So again, it's a very useful piece of information, which if you have your kit with you, is easy to distribute. Some people, Sharon mentioned that she takes her kit with her when she's out of town, which is a good idea. Some people actually have multiple kits. They have one in their house, one in their car, and maybe if they have a vacation home, they have one at the vacation home. But they have several of them so that they are everywhere that they need to have them. One caution: if you keep one in your car and you have medication in there, heat can affect your medication. So just think about that. About maybe the medication is in the one at home, but not in your car. Okay. Next slide, please. Okay, so before I get into this slide and kind of wrap up, there's a couple of other things in the Aware and Care kit that you might want to be aware of. One is a little medical card that you can fill out that says, I have Parkinson's, I am not drunk, and it gives the information. It has a place to put the information for a family contact or a medical contact. And it's a card, again, that you can just put in your wallet or your purse and carry with you. The other thing that's in the kit is a little ID bracelet, the medical alert bracelet, basically, that if you choose to wear, again, is not a bad idea, because again, if you're in an emergency situation, you're in a car accident, it immediately lets a person who's attending to you know that you have Parkinson's. So I urge those of you who don't have a Wear and Care kit to order one. You should be able to get one fairly quickly. They're usually maybe 3 to 5 days, and make sure that you fill out the necessary information and have it available. So just to summarize, Aware and Care is a national campaign to prepare and empower people with Parkinson's disease through tools of information to be your own advocate in a hospital setting and an engaged partner in your own health care and overall in your health care. So we educate healthcare providers and staff to help people with Parkinson's get the best possible care while in the hospital or other inpatient setting. That could be rehab or long-term care. It's an important initiative. It's getting stronger. There's the Parkinson's Foundation about a year ago published a monograph which some of you may be interested in, that is centered on recommendations to hospitals, and we've begun to partner with some hospitals to get those recommendations implemented, and understanding that it's not something that's going to happen overnight. If any of you live in areas where you think a hospital might be interested in this, you can certainly get in touch with the foundation and they can possibly follow through with it. Next slide, please. Okay, so again, Aware and Care Ambassadors, and that name has now been changed. We now refer to as hospital lead, hospital ambassadors are just straight ambassadors. Parkinson Foundation volunteers are trained to educate the community. So this would be people that just have an interest, but don't necessarily know what's appropriate for care. Educate clinicians that treat Parkinson's, and again, this is nurses and doctors. I've done several presentations at local hospitals in my area where I'm providing information, especially about drugs and drug timing and inappropriate drugs to nurses, and then to educate other hospital staff to think about where they need to adjust care. And that's the whole notion behind the hospital care initiative. Okay, next slide, please. Okay, so Aware and Care is made possible by the Parkinson's Foundation. It is underwritten to some extent through the philanthropic contribution of the Edmund Saffer Foundation and individuals like you. Thank you for your support. Final slide. Next slide, please. Okay, the Parkinson's Foundation is designed to make life better for people with Parkinson's by improving care and advancing research towards a cure. Everything we do is to help build energy, experience, and passion for our global Parkinson's community. And there's, at the bottom, you can learn more about Parkinson's online at the parkinson.org website, or you can call the Parkinson's Foundation helpline. And I've also put my email there if any of you want to communicate with me directly, or if you're involved in a local hospital or a local support group that you think would benefit from an Aware and Care presentation, you can contact me and I'll be happy to help set that up, or if necessary, hook you with people in your area that could be helpful. Okay, that's it for me, unless you guys have some specific questions that I can answer.
All right, so raise your hand or put your hand up. I found this, first of all, I was looking through my kit and I realized I have I have a Parkinson's Foundation, National Parkinson's Foundation kit. Mine is so old and ancient, it doesn't have a lot of the new materials. I do have a newer one. I went to look for it. I have no idea where it is. But I did find in there, I don't know if you mentioned, this one had a magnet that you can put like on your bed. It says, I need my Parkinson's medication on time, every time.
I don't believe the new kit has that.
They should.
Yeah, it should.
And then it has, for more information, call, and it has the information, but it's great. This is a magnet that you can put anywhere. Okay, so any questions? Karen has her hand up. Anybody? Karen, go ahead, and then if you have questions, either raise your hand and electronically or raise your hand physically. Okay.
Thank you. I just want to share with everyone that I have young onset Parkinson's, and between March 18th and April 3rd, I was in 3 emergency rooms, 2 in New Jersey in Bergen County. I was released, not treated. They withheld my medication. The second time in another hospital, I was they didn't listen. I had the card, the wear and care card. It had the list of all my medications. It had everything on it. They took all my medications away. I spent 12 hours in the hallway of Hackensack Hospital in the emergency room where one attending, I had a CAT scan right away. I was brought by ambulance there. So sometimes when an emergency happens, you're brought by ambulance. I didn't have a bracelet on. I had double vision. I had a lot of things going on, but the end result was a second ambulance to a third hospital where I was inpatient. And I find a breakdown in the system to be the communication between the nurses and the doctors and the broken chains and the shift changes and um, so many. I don't want to say, but the nurses, I was crying out like, help me, help me, help me. Number one, I wasn't given medicine. I was dehydrated. All things, with my initial being brought in for subdural, which is a serious situation. On top of which, I had a couple days where I missed doses due to nursing error, reverse doses. When we're talking not more than like 2 hour differences, but 10-hour differences. And breakdowns in communication. And I was at a center of excellence in Manhattan for, I think, inpatient for about 10 days, where there was one attending neurologist. And then there was a second one, but my neurologist, like I really had to advocate for myself and have a friend advocate for me. But when, at one of the hospitals in Hackensack, they strapped me to the bed. They decided I was a fall risk and I was strapped to the bed. They put a diaper on me overnight. I didn't have my medication, but all this resulted in a rapid decline. So I just think that, even with this, I feel like the lack of awareness on the nurses at night, it's kind of like the breakdown can occur on an individual basis. And the hospital can be a very, very dangerous place. I'm 56 years old and I'm recovering from damages done to me, when I was inpatient, where I went in for one thing and then I experienced far other things. You know, Results of these errors that you're describing.
Did you say you were in Hackensack?
I was in Hackensack overnight, but I was left in the ER in the hallway without an IV. I was told I had a stroke. I mean, one person ran by me, then they lost me, and then one attending neurologist said, "Oh, I've been looking for you." It was probably the worst 24 hours of my entire life, and I have hemidystonia and Parkinson's. I've got LARC2 and GBA, and I feel like I almost died. I had blood pressure crashes. I literally stood in front of a nurse once I was at Mount Sinai, and she was just misinformed. And it was 8 o'clock. I said, "Please get me my medication. It's 8 o'clock." And I was standing up in front of her, and she said, "Well, I'm not going to go get it until the PA comes to let me." She just sat there, and I said, "Well, I'll walk to the pharmacy and I'll get it then." There were two nurses out of probably 10 that knew or understood that 2 hour window is not appropriate. Not you know it, it's This is at a center of excellence. I had a couple nurses, one that ran up and down the stairs twice. There was a pharmacy error. The wrong dose was sent up. I was on the 8th floor of the hospital, so I had one nurse named John. Even with that, my Rytary was given to me 2 hours late. I had experienced dystonia through my torso and twisting that I've never experienced before. Orthostatic hypotension, I almost died. My heart rate, I'm grateful that I just wanted to get home, and I felt like I had that was the number one way to, I felt like I was more in danger being in the hospital after, once we had the MRIs and I knew what I was dealing with. I've got a nerve palsy now. That's why I have an eye patch. But I didn't have this before. I didn't have this before 2 Valley Hospital ER visit. So, you know, I'm sorry, but it is a horror show sometimes
Mhm.
when you go in the hospital for one thing, which for me was a headache when I came out.
We all need to be more,
Yeah.
we all have to be involved in Parkinson's advocacy, make sure that these doctors.
Yeah, like it's kind of like I feel like the nurses maybe, or it's kind of
probably.
like the shift changes.
Yeah. All right, we need to move on. Katie had
Yeah,
her
thanks.
stuff. Katie?
I found having my medicines in my aware and care bag when I go to the hospital, they can't see them, so they don't know that I
Oh.
have them, so they don't take them.
Hmm.
And I've had a
I
nurse
think
trade me one of my meds when they couldn't get me my med from the pharmacy.
Yeah, some hospitals are very rigid about that, and they will attempt to take them away from you. So if you have a care partner with you, he or she can monitor that a little bit. But yeah, it's the story that Karen just told is far too familiar to us.
Hmm.
I'm sorry you went through that, Karen.
Yeah, I think we all are. All right, we're gonna move on, because it's 10:02, and I wanted to have quite a few announcements to make, so I'm going to share my screen or, let's see. Let's go on. Okay, so next slide.
Sharon, you want me to stick around or?
Yes, stick around for a minute, Ken, please.
Sure.
Okay, our t-shirt sale is on for 2 weeks only. We are now offering white t-shirts, and we have a t-shirt for men, although we're going to bring that up in a second. Some people wanted t-shirts for their husbands, but we're going to see what we can do about that, because I really don't think they want to wear this wonderful Twitchy Woman logo. But you can order the t-shirts now in black or white. And next slide. My thought for a slogan was, I'm with Twitchy. It would probably print it on the back, not do the logo on the front. But if you have something you want to come up with, something cute and funny, send it to me by Wednesday, and we will put it out for everybody to vote on for a few days, and we'll announce the winners next Sunday. Okay? Anything come to mind right now? Susan has something. Susan, you want to tell us? Susan?
No, no. I don't have anything extra except buy those t-shirts.
Okay, you had I thought you had a slogan. Okay.
I forgot what I said before. I'm with Twitchy, but real men support Twitchy women.
Yeah, I like that too.
I'm with Twitchy.
Yeah, so come up with your ideas and just email them to me in the next couple of days, and we'll put it out for voting. Okay? All right, next slide. We talked about this. If you're going to Barcelona and you haven't let us know, please let us know, because we're going to try and all get together at some point, and we will definitely have a get together at the opening ceremony. We're going to try and get a number of seats. It's going to be about 25 of us. I think with Care Partners posted to 35 people, which is fabulous. Okay, let's go on. Next slide. Next week, we've had a 3-week hiatus because of holidays. Next week, we have Donna Dow from Electronics, and I spelled that wrong, but she will be speaking about the latest, the new systems for DBS. And then in May, we have Robert Cochran from Yes and Exercise, which is improv for PD, otherwise known as Yes. And if you haven't done his classes, he has classes on Tuesday mornings and Thursday afternoons. Go to Yes and Exercise. You can email me if you're interested. It's a lot of fun, fun and games. And then on June 4th, we have Rochelle Flanagan. And by the way, May 7th is the only meeting in May because of Mother's Day and Memorial Day and other things. So So we're gonna skip ahead to June 4th, and Michelle Flanagan, who's spoken before to this group, has created a new app called My Moves Matter for women with Parkinson's. And where if you are young onset, especially, you can track the menstrual cycles and your symptoms and exercise and everything, and see how everything comes together. How if your symptoms get worse before your cycle, after your cycle, etc. Okay, next slide. And reminder, we have our 2 chat groups going on Tuesday mornings. We have with Shelley, that's open to everyone. Sunday mornings before our regular meetings, we have Twitchies Without Partners. And next slide. So in addition to supporting Twitchy women, we're going to have an annual fund campaign coming up. I just have to come up with the details. But if you are interested, you can sponsor a Sunday morning webinar and have your name and like. So we could say, you know, at the very beginning, it's sponsored by Susan Lehman. Susan, I'm picking on you, or anybody else. So there will be opportunities to help sponsor those mornings. Our first meeting is today at 11:30, so in about half an hour we will be meeting. Carol Klupney will join us. She's the author of The Ribbon of Road Ahead, and Amy Wilcox will be facilitating that meeting. So this is our very first meeting. We have 12 or 13 people registered. It's not too late. We can put the registration link in the chat for you real quick. So we'd love to have you join us, even if you haven't read the book. It's going to be fun. And that's our last slide, am I right? Oh, I forgot about this. I was interviewed earlier this week by Joy Cochran from Urban Polling, who was our speaker a couple weeks ago. And it was supposed to be live yesterday on their podcast page, but we can't find it. So we will keep you informed about that. But and you know, hopefully we will have it by when the newsletter goes out again tomorrow. And that is it. So thank you, Ken. That was very informative. And anybody that wants to stay on a little bit longer is welcome to stay on for a few more minutes. I am going to have to find I do have a newer Aware and Care kit now that I realize that mine is antique. I've got to find the newer one. It's somewhere in my closet. And please order yours today if you don't have one, because you see how important they are to have. It's really an essential part of your care kit. And with that, I want to thank everyone.
Thank you very much for having me. I appreciated the opportunity.